There is a saying in Sanskrit, Sarvendriyanam Nayanam Pradhanam. It means eye is the most important sensory organ of the body. Without vision, the life is miserable. Today, we are able to appreciate and enjoy the beauty of the nature that God has created for us is only because of our eyes and healthy retina. Diabetes is one of the metabolic diseases damaging the retina and causing visual impairment and blindness. Diabetic-related blindness is increasing rapidly, not only in urban but also in rural India. As a responsibility towards the society, World Diabetes Foundation, Pabolu Ogirala and Sri Ram Charitable Trust and Modern Eye Hospital and Research Center joined hands together. To tackle this global problem, we started a project named Diabetic Eye Disease Prevention and Reduction of Blindness Rural Andhra Pradesh in India. The project, with the funding from World Diabetes Foundation, was inaugurated on 15 July 2007. This inaugural function was well attended and with a gathering of more than 200 people. People from all walks of society took part in the meeting and pledged their support.
After doing all the groundwork, we started the project on August 14, 2007. The project is focused mainly in three areas. One is awareness creation, actual screening of general population and population at risk for diabetes, and the third is identifying and treating diabetic retinopathy patients.
Awareness programs were conducted for the general public and social groups like Lions, Rotarians, physicians, general practitioners, paramedics, rural medical practitioners. During the awareness program, the magnitude and social impact of the diabetic-related blindness was stressed upon to the audience. Public education materials were distributed among the audience. Within a week of the awareness program, a camp, either community or exclusive diabetic retinopathy screening camp, was organized in that area. All the patients attending the camp were screened for diabetes by urine sugar and blood sugar by glucometer. All the diabetics were subjected to detailed ophthalmic examination by the ophthalmologist, which included dilated fundus examination. those at risk of retinopathy are transported to the base hospital for further investigations and treatment. Free transport is offered to the patients who are willing to travel to the base hospital on the same day. For the patients who want to come later or who have uncontrolled diabetes, a counseling session is done to ensure their compliance for treatment, and their addresses are noted down and an appointment with the base hospital is fixed. In the base hospital, the patient is re-examined in the retina clinic. A final diagnosis is made by the retina consultant. The needed will undergo investigative procedures like angiogram or ultrasound. After getting the reports, the patients are offered laser treatment. During the first 3 quarters of the project, we could screen 37,396 people in Nellore, Prakasam, Chittoor and Kadapa districts of rural Andhra Pradesh. We identified 1,648 diabetic retinopathy patients and could treat 784 patients with FFA and lasers. 430 physicians, 103 ophthalmic assistants, 285 nurses were given awareness program. 106 awareness fixed charts were put up at various primary health centers.
It is almost 1.5 years since we started this project. The response is so overwhelming that we are so happy to see the patients coming themselves for screening for diabetic retinopathy.
All this was possible with the help of World Diabetes Foundation. And we feel this is only a beginning. We have miles to go to reach our goal.